not just good news on the vaccine front, there's good news on the numbers front in terms of Victoria. Is there also encouraging news in terms of their contact tracing and their testing? Is their capacity improving?
There was a visit by federal and Victorian officials to see New South Wales Health and the New South Wales Premier Gladys Berejiklian on Friday to find out about their systems for keeping hold of coronavirus outbreaks and out of lockdowns. It was a full-day session involving a Deputy Secretary of the Federal Department of Health, Commodore Mark Hill, who heads up the ADF response in Victoria, the Chief Scientist Alan Finkel and senior Victorian health officials. And you can see from this tweet from Brad Hazzard, the Health Minister in New South Wales, school was very much in. Gladys Berejiklian showed up after she had to deal with a Nationals rebellion led by John Barilaro, but much of it was led by Mr Hazzard and the health officials. With Victoria about to head out of lockdown, you wonder why this swapping of notes on contact tracing and the like did not happen earlier. The officials were shown the New South Wales State Operations Centre and taken through all the coordination of pathology services and testing and contact tracing operations, which has led New South Wales to be a success, to keep their case numbers low and stay out of lockdown. The Victorians and the federal officials were told about the police hotels for international travellers in New South Wales and the health hotels where overseas travellers with coronavirus are taken. Victorian Premier Dan Andrews and the PM sent this group up. I asked a federal source why they were not sent up months ago for such an education session. They said the federal government had been trying to get the Victorians to do more on contact tracing for months. Here's an interview I did with New South Wales Chief Medical Officer Kerry Chant earlier in the week, where she explained how coordinating pathology services, public and private, was so key to getting fast test results back and being able to keep on top of outbreaks.
So the first thing is we need to get the community on board to get tested, and we need to make testing easy. So we've done that by we've got a centralised pathology service, New South Wales Health Pathology, and we've worked also from an early stage with the private pathology providers to provide that multiple points of entry. We've worked with the community to get them to come forward for testing, and we've done this rapid turnaround test results.
So they've been able to keep on top of it. We know Victoria hasn't. Victoria had just 37 new cases yesterday. The numbers are coming down with the lockdown. But I suppose the concern is, even if they open up soon, is there an undetected community transmission around, or are they just unable to have the contact tracing capacity to stop a third wave? Here's an excerpt of a report in the Saturday paper yesterday, purported to be a Victorian Chief Health Officer Brett Sutton discussing the failures of contact tracing. He said the goal was to get down to a point of such low transmission that either it ends community transmission or we can manage it with robust surveillance and contact tracing and case follow-up. But asked about criticism of the contact tracing system, Sutton says it was totally challenged. Even at lower numbers, there were some intrinsic challenges with contact tracing, and something we reported last week on how old their systems were. He says we had some old systems, and when we wanted to have surge support from all other jurisdictions, we had to go to a paper-based system, fax machines. He said the technology powering the tracing effort should have been part and parcel of our response for years. What an error. So what happens when the lockdown ends? Does a third wave begin because the systems are so garbage? Well, the federal source claims that Victoria has improved to the extent that they could stop a third wave. Here's the quote: "It's not as good as New South Wales, but can easily handle it. And this week they finally adopted everything we've been asking for," this federal source said. The other issue in relation to this virus at times has been the media reporting, I think. Perhaps instead of reporting New South Wales recorded 20 cases a day, shock horror, we need to look at the fact that there are just 10 or 20 new cases a day, because that really is a low number. Someone in the federal government likened it to bushfire alerts. When a fire is lapping at your suburb or a few kilometres away, then you look to evacuate. One coronavirus case in your area is not a fire lapping a few kilometres away, a need for you to look at shutdowns or wear masks everywhere. 100 new cases a day in your city or state is. So the Prime Minister, Scott Morrison, he'll have another go at National Cabinet this Friday at this definition of hotspots he wants to get up around border closures, 10 new cases a day over 3 days. Judging by Northern Territory Chief Minister's post-election pronouncement on Friday, suggesting he's about to open to Sydney in October, and South Australian Premier Stephen Marshall suggesting he's not far away from that. It looks like we will have New South Wales, Victoria, South Australia and the NT potentially agreeing to the hotspot definitions, with Queensland, WA and Tasmania as the holdouts, Kieran.